ACA subsidies expiring. Here's a story from the front line, which I hope will give everybody food for thought on why this is such a terrible situation. So I've got this young patient, let's say in the mid-20s, without giving out too much information, who started seeing me in April, Mayish, who has a marketplace insurance plan with some vague symptoms. I'm not going to detail the diagnosis, but let me just tell you the journey of that initial visit of having vague, non-specific symptoms to now 6, 7 months later has led us to the point of a diagnosis which could be potentially life-altering. Getting to that point of that initial workup that I did to getting him to a couple of different specialists has not been easy because a lot of specialists don't take these marketplace plans. So we had to hunt and find, and we found specialists that took the workup I did to do further workup, and we are on the verge of diagnosing something potentially serious. It is December, and the next step for this patient is to follow up with their specialist and potentially get a muscle biopsy. And all along, he's a young man who's obviously not medically literate and just trying to figure out, what do I need to do? I don't feel well. I'm getting weaker. I'm gaining weight. I'm just not doing well. What do I need to do? I just want to get better. And I've been preaching patience, like we're getting to the right people. We're trying to figure out what's going on. And we're on the cusp of answering this question so that we can get a formal diagnosis and get you the right treatment to stabilize whatever condition you have so you can start living your life and improving your health. And of course, now it's December, and I've been informed by this person that he may not be able to afford his insurance next year because of the ACA marketplace insurance subsidies expiring. And we may be going into 2026 after a 6 month journey, trying to get to a diagnosis so we can get this person the right treatment, start their life. He may not be able to get this muscle biopsy without insurance because that's just an expensive procedure. 6 months, we are this close to getting the answer we need to get for him to get his treatment, and now it may all be lost. Either he's just going to have to fork over way too much money to try to get this test done so he can move on with his life, not likely happening, or he's just going to completely ignore this next test and just let the disease progress and we're not going to get any answers. That's just an awful outcome. Or he's going to twist and float around in the county health systems and the free clinics or whatever systems are in my town to try to find a pathway to somehow get answers to his condition. And of course, it's essentially starting the whole process over, right? It took us 6, 7 months to get to this point, and so he ends up in another county health system. They're going to start the whole process over. So for anybody who questions the value of ACA subsidies and the care that these folks are giving, here's an example of a real living human being, a young person just trying to make it through with a potentially real serious medical condition that we are on the verge of getting the answer for him so he can get treatment. Now it's all going to be nearly impossible.